I'm Nathan Jacobson. I'm an orthopedic surgeon here at Great Plains Health, based out of North Platte, Nebraska, and I have a subspecialty in sports medicine. That has taken me to some new horizons here in the Midwest, and I've gotten involved very heavily in rodeo over the past few years. And we've developed a local program where we actually travel out to all the Mid-Plains region college rodeos, all 10 of them, provide medical support there. And then we also cover local professional and amateur rodeos as well as high school rodeos. This all got started off as an idea by our lead athletic trainer, Tyler Oberlander. He pitched it to me and then got me on board. We thought it was a great idea and we'd fill a need in the community that did not exist.
My name is Tyler Oberlander and I work for Great Plains Health in orthopedics and sports medicine. Rodeo is beautiful as far as our profession goes because you get a pretty wide variety, a lot of acute care, you know, with a nice mix of a lot of chronic stuff. We'll show up about 2 hours before and start doing pre-game treatments, and it ranges from tape, brace, stem, heat, you know, a lot of stretch. And during we'll do treatments at a busy pro rodeo like Burwell or North Platte. Shoot, I'll see people the entire way in the trailer through the entire perf. And then we'll handle the guy that goes down in the arena as well. We generally be the first line of defense, and then if we need to transport, we'll work with EMS, they'll wave them in.
If they have a more minor injury, we treat it in the trailer, continue with home therapy exercises, and we'll follow them up each week at the consecutive rodeos that we see them at. If it's more of a serious injury or we feel like that we need to get some imaging, whether that's just plain x-rays or an MRI, sometimes I can get those ordered directly at the hospital without a clinical visit, but most of the time we have them come in to see me. We do a formal clinical visit in my office and set up the appropriate follow-up imaging and potential surgical intervention as needed from there. The vast majority of the services that we provide are basically done free of charge to the athlete. We have had patients or family members in the past offer to pay us for our services, and we just refer them back to the Great Plains Health Foundation, and they do take donations, and they'll use it for supporting our program as well as other altruistic opportunities that are presented to them in the hospital system.
The idea is to improve the quality of life of the cowboys, because there's not a lot of people out there that are looking out for them when you're going down the rodeo trails. So we try to be that, you know, little bit of help along the way. This is the one that just seems to hit. The rodeo athlete is one, for several reasons, more fun to take care of. Because one, they're tough, and when you get someone who's tough, you can do a lot of cool things. You can brace and tape and do treatments and make that human body do things that not even maybe they thought they could do. You know, the other thing is they're very thankful for what we do. It is so humbling to have people, you know, years later come back and know you and just come in to say hi. You know, they don't want anything, they just want to say hi and say thank you. You know, our job is to make their lives better, and they recognize that. So they're a lot of fun to work with. They're a very humble group of people. They just can't believe that they get something like this for nothing, you know, for free of charge. And it's a very rewarding group to work with.